Hi, hope you're all doing good. In the wake of coronavirus pandemic, COVID-19, we are coming across tons and tons of information through various platforms, including social media. Just because it's easy for us to share information which we have come across in WhatsApp or Telegram or any other social media based platform doesn't mean that we can do it without actually verifying the source and without actually checking the authenticity of the message which we are forwarding. Because it's better to keep quiet rather than to spread misinformation, as it does more harm than good, isn't it? So please keep a tab on the information which you have been spreading or passing from your side, and also keep a tab on WHO website for all the latest information updates pertaining to this pandemic. And let's be more responsible rather than just simply forwarding all kinds of messages without actually checking the validity of the same, because it does more harm than good, right? And in the wake of this coronavirus pandemic and the growing number of cases worldwide, even the Dental Council of India has issued an advisory to all dental colleges, including dental hospitals or clinics, so that we can take adequate measures to protect ourselves as well as our patients, right? So let's go through the same. So Dental Council of India has issued an advisory to all dental colleges of the country to take the following necessary precautions and preventive measures. All the faculty and students of dental college shall avoid their biometric attendance till March 31st, 2020 and mark their attendance in attendance register only. And the classes of first year to fourth year BDS at all dental colleges of the country shall remain suspended till March 31st, 2020. In the wake of COVID-19 outbreak going on in the country, dental college shall not conduct any seminars, workshops, conferences, camps, etc. And all dental colleges shall strictly comply with all the advisory issued by the central government or state government or UGC from time to time, including universal precautions for infection control. Clinical procedures involving aerosol generation, which we are more prone to, that is aerator usage or ultrasonic devices, to be avoided or minimized for time being, and only emergency procedures to be performed. And a copy of interim guidance dated 25th January 2020 issued by WHO on infection prevention and control during healthcare when novel coronavirus infection is suspected is attached herewith. Also, we'll be sharing this document in this video itself. And recommendations for safe clinical practice in dental clinics or hospitals in view of COVID-19 outbreak are as follows. All dentists and support staff should wash their hands thoroughly with soap and water and follow up with alcohol-based hand sanitizers before and after every patient. Surgical scrubbing of hands is recommended. Disposable gloves to be used routinely as usual. Staff and doctors should avoid touching their face, especially ear, nose and mouth. Every patient who enters and exits the clinic should be provided hand sanitizers. I know they are in very much demand, but we need to do our best to provide the same. The waiting room clinic, including the handles, doors as well as dental chairs and other surfaces, should be wiped several number of times in a day with alcohol-based disinfectant. Thorough medical travel history of each patient should be recorded before any clinical procedure. Here comes the importance of history. And patients should be scrubbed with isopropyl alcohol extraorally, and pre-procedural rinse with povidone iodine is recommended. Usage of N95 mask or at least 3-ply masks and suitable head caps. Protective eyewear and face shield is recommended, and fumigation of clinics periodically is advised. So let's keep all of these advices in mind and try to implement the same to the best of our ability in order to save ourselves and the people around us. And WHO has been extensively promoting certain safe and hygienic practices, including washing hands with soap and water regularly with a particular technique which we discussed in one of the previous videos, and avoid touching your face, ears, eyes or nose with your hands. And if at all you're coughing or sneezing, do it in the bend of your elbow or into a tissue paper. And also practice social distancing, or at least maintain 1 meter distance if at all you are in a crowd, and it's better to avoid going to a crowded place. And also travel advisory has been suggested by many countries, and in fact they have been cancelling all visas, and they have been advising their citizens not to go for a non-essential travel, right? So do keep that in mind as well. And if you have any symptoms, do quarantine yourself. Self-isolation is very important, and call your doctor or nearby health facility, or utilize the toll-free landline numbers that are being provided by the government, and take necessary steps accordingly, right? So let's all be responsible and try not to simply forward all messages which we come across in social media without actually verifying them, and also keep a tab on WHO website for all latest updates pertaining to this coronavirus pandemic. So wish you all the best. Love you all.